Hi there, this is Dr. Laura Jones, and this video is all about parasites. It's a subject that I'm sure a lot of you have a lot of questions about. It's a subject that a lot of us get a little grossed out about, but it's also a subject that us healthcare providers need to make sure we learn a lot about so we can be on the lookout for signs and symptoms of parasite infection in our patients. So let's dive in. Human parasite infections are conditions or illnesses that are caused by parasites living within or reproducing within the body. A parasite is a creature that lives in or on a host organism, so that then that parasite can get food, often at the host's expense. This food provides parasites with the nutrients that they need for survival, so a parasite must have a host. Many Americans are incorrect in believing that parasitic infection in the U.S. is rare. In fact, the CDC reports that parasitic infections are indeed here in the United States and affect millions of us Americans each year. Despite previously more common parasitic infections, for example, malaria, being successfully eliminated here in the United States, other parasitic infections remain endemic, creating a pretty significant public health concern. Numerous parasitic infections also come into our country. They are imported each year. Intestinal parasitic infections are more common in developing countries, but cases are also increasing here in the United States due to international travel, due to migration, due to the globalization of food. So the prevalence of parasitic infections certainly varies from one part of the country to another due to things like the environment, the climate, the geography, the social conditions in that part of the country. Parasitic infections are certainly more common in warmer climates and areas with crowded living conditions, poor sanitation, or insufficient water supply. They're also more common in individuals with lower incomes, with less education on personal hygiene, with less education on food preparation. And due to the curious and very subtle ways that parasitic infections present, including symptoms that easily overlap with a variety of other chronic health concerns, the diagnosis of parasitic infections can be easily overlooked even for several years. So when left unaddressed, unfortunately, parasitic infections tend to worsen, and most commonly they result in chronic gastrointestinal issues, nutrient deficiencies, skin diseases, and even chronic pain. This is where functional medicine, of course I'm a little biased, but does a great job. We actually have many effective tools for diagnosing parasitic infections. In addition to identifying the exact parasite, we have many test panels that reveal effective and efficient treatments to eradicate the parasite, but also spare the integrity of the microbiome, which we all know is so important to preserve the microbiome as absolute best we can whenever we're dealing with any other type of infection where we may need to be using an antimicrobial or an antiparasitic. So let's dive in a little deeper and understand a bit more about parasitic infections. There are three predominant classes of parasites. This includes ectoparasites, protozoa, and helminths. So all three of these are known to cause parasitic infections in humans. Let's start with ectoparasites. These are parasites that live on the exterior of the host. So these include several that we are familiar with: fleas and lice and mites and ticks and scabies. So these ectoparasites are vectors that can carry infection through blood, affecting both animals and humans. Helminths is another category of parasites that affect us humans. Helminths are multi-celled parasitic worms that infect the gastrointestinal tract. So this class of parasites is what most of us are accustomed to thinking about when someone says the word parasite. In adulthood, these helminths are absolutely visible. They can range from 1 millimeter to 1 meter in length. Helminths include roundworms. They include flatworms. They also include flukes. They include tapeworms. Most helminths cannot replicate in the host, so they can only lay the eggs there. And so the adult helminths leave the host through the stool, but the eggs remain in the intestine, creating an opportunity for spreading to those who come into contact with contaminated stool. So surfaces, water, food that have been contaminated are a great way for somebody to go ahead and get the eggs and get the infection. Protozoa is our last class of helminths that more commonly affect humans, and protozoa are unique in that they are single-celled parasites. They can affect the gastrointestinal tract. Protozoa can also affect the blood and even other bodily tissues. A microscope is necessary to see protozoa. Protozoa spread when you ingest trace amounts of stool or soil that is contaminated with eggs from the stool. Most often that is water or produce, so fruit or veg. Protozoa are different from helminths because they're so much smaller in that they are just one single cell, and they can replicate very easily and quickly in the host. Tens of thousands of protozoan species are out there, and interestingly enough, they are categorized by the type of locomotion that they use, so how they move. So let's talk about each type of protozoa. One would be an amoeba. Amoebas employ false feet, also known as pseudopods, for mobility. An example would be Entamoeba histolytica, which is a common intestinal parasite. Some patients actually have a lot of symptoms from this parasite. Others have none, so it depends on the patient. Another type of protozoa class is a ciliate. Ciliates are defined by their delicate, short, little thin hairs. They're little structures that they use to gather food and to move around. Another type of protozoa would be your flagellates. Flagellates have a whip-like flagella, allowing them to assess their surroundings and move around. And a flagellate that probably most of us recognize is Giardia. Another one would be Trichomonas vaginalis. So those are two more common flagellates here in the United States. And the last type of protozoa is a sporozoan. Sporozoans are a little more boring. They're non-flagellated, they're non-ciliated, they're non-amoeboid, so they really are unable to move in their adult state. Examples of them would be Plasmodium and Cryptosporidium. I also want to talk a bit, though, about not just the types of parasites, but what are the actual most common parasitic infections here in the United States. Absolutely, the number one most common intestinal parasite in the U.S. is Giardia. It is caused by the flagellated protozoan, and Giardia symptoms a lot of us are familiar with: diarrhea, abdominal cramping, gas, bloating, abdominal pain. People are likely to get sick with Giardia if they, A, are around someone else who has it. It's contagious in that way. Especially children are more vulnerable to getting it. Or B, people who have limited access to safe drinking water. So people who are drinking untreated water from shallow wells, people who are out backpacking, drinking from springs or lakes or streams or ponds, they are at higher risk for Giardia. Another common parasite here in the United States is Toxoplasma. Toxoplasmosis is caused by Toxoplasma. And this is most commonly contracted from consuming undercooked meat or, believe it or not, from cat feces. The parasite can pass to a baby during pregnancy and cause birth defects and miscarriage. So we have to be really careful with our pregnant women, even around a litter box, for example. Toxoplasma is unique because most people infected with it are asymptomatic. But people who are immunocompromised or infants, pregnant women, we have to be really careful with Toxoplasma. Third common species of parasite in the U.S. is Ascaris. This is the roundworm. So a roundworm infection is one that a lot of us envision when someone says parasites. Adult worms can be more than a foot long. Ascaris is one of the most common worm infections worldwide. It is present in the U.S., but much less so than in tropical or subtropical regions of the world. If the infection is mild, a lot of people don't even know that they have it. It's when the worm load is heavier that symptoms can be more severe. And Ascaris is interesting. Once the eggs have been swallowed, the larvae hatch in the small intestine and they migrate through the bloodstream to the lungs. And then this can cause signs and symptoms similar to if they had a pneumonia or bronchitis, where they will have a chronic cough, they'll have wheezing, they'll have shortness of breath. Hookworm is another common one here in the U.S. Hookworms get their name because they have a hook shape to their head. And adult hookworms and larvae live in a person's small intestines. Hookworm infection occurs when people walk barefoot through soil contaminated with the eggs or larvae. People can also contract hookworm when they have consumed eggs through contaminated soil. So 2 ways to get it. Believe it or not, that larvae can enter the skin on the bottom of the foot. And when it does that, it can cause an area of irritation or itching or rashiness to the skin where it entered. People with more severe infection may experience abdominal pain, diarrhea. Over time, because the worms grow and they attach to the intestinal wall, and that's where they feed, a patient with hookworm can lose weight, and they can even become anemic. So something to be aware of there. Last common infection here in the U.S., parasitic infection that I want to make sure to touch upon is the pinworm. Pinworms are definitely the most common worm infection here in the U.S., affecting, believe it or not, 40 million people. Pinworm infection is called enterobiasis, and it's absolutely most common in school-aged children, but can affect people of any age. The adult pinworm, the female, will go lay eggs around the anus, and that is why people with pinworm often will have pretty severe rectal itching. Female may even have vaginal itching due to the irritation of the tissue in that area. And what we listen for is sleeplessness up in the night because of the itching. So that's a really key thing to listen for in our patients where we may suspect pinworm infection. There's lots of different ways to identify parasitic infections. Of course, where we might look and the tool we might use to test with absolutely depends on the symptoms that the patient is experiencing and where in the body we suspect that the infection may reside. Common symptoms that we're listening for when we're thinking about running up tests for parasitic infection include diarrhea, nausea, vomiting, rectal itching, but also fatigue, muscle and joint pain, sometimes even fever, rash, itching, even hives. In some cases, the patient may have even noticed changes in their stool or believe what they may be seeing is a worm in the stool. Encourage patients, if that's the case, to take a picture of that because it can be incredibly valuable to show the provider, even more so than maybe parasite testing with an ova and parasite microscopy test. So providing your doctor with a picture of what you believe is a worm is not to be poo-pooed. Parasitic infections that affect the blood, the skin, the genitals can be a little more challenging to identify. And so typically we're using what's called the O&P, ova and parasite test. The CDC recommends that when we're looking for parasites, we want to do a 3-day test with a sample, a different stool sample from each day. And so that's kind of the gold standard of parasite testing. Several conventional labs do offer 3-day and 1-day parasite testings. You always want to go with the 3-day when you can. But I also want to mention here that some of our functional medicine panels offer a more comprehensive parasite panel where not only are we doing the 3-day stool collection, but in addition, the panels are screening for over 30 parasites, other fecal inflammatory markers, and fecal white blood cells, which can be very helpful in the diagnosis. When we suspect parasitic infection that's affected the lungs or the liver, that's where imaging may be of value. We also might use a blood smear to identify certain types of parasites that affect the blood, for example, malaria. Vaginal swabs are used, or urine samples are used for the diagnosis of trichomoniasis. And some protozoan infections are actually easiest to diagnose with molecular techniques such as PCR. So PCR is what we're doing is there's a diagnostic primer and it tests DNA preparations that we get from the fecal samples. And we're able to actually identify parasites even when the sample is small or the amount of parasites in the sample is very low. That's where PCR could be particularly helpful. Now, I also want to talk about how the immune system put out our various inflammatory cytokines, including IL-1, IL-5, IL-13. And these are critical indicators of allergic inflammation. They can trigger changes in the intestine, in the tissue in the intestine that makes the intestine much less hospitable or much less inviting for the parasite. And so this is how the innate immune response works. In addition, the adaptive immune response is triggered in parasitic infection, and this is where the immune system starts making antigen-specific targets to go after the parasites. We also see cytotoxic T lymphocytes are involved. So white blood cells, also known as leukocytes, I know most of us know this, but huge refresher just in case you don't remember, they also play a super critical role in protecting the body when we have any type of infection. Leukocytosis is defined as the increase in white blood cells, and leukocytosis can occur just from the increase of one type of white blood cell. So for example, in parasitic infection, we can have leukocytosis, so blood testing with just a simple CBC could be helpful. And we're looking for rises in eosinophils and basophils. Those are the two types of white blood cells that are most commonly elevated in parasitic infection. A little note though, remember also that those two types of white blood cells also can be elevated in allergic disease. So if it's a patient who has a history of eczema or chronic hay fever, we also need to understand that the elevation in those types of white blood cells could be due to the presence of allergic disease. So just be aware of that. Now, as a functional medicine provider, my most common tool when I'm dealing with parasitic infection is herbal antiparasitics. So we've got a list of herbs that actually have a lot of great antiparasitic compounds in them, which can be very effective in employing during a treatment plan for parasites. But we do not just use an antiparasitic herb when we are treating parasites if we are designing as a functional medicine provider, my most common tool when I'm dealing with parasitic infection is herbal antiparasitics. So we've got a list of herbs that actually have a lot of great antiparasitic compounds in them, which can be very effective in employing during a treatment plan for parasites. But we do not just use an antiparasitic herb when we are treating parasites if we are designing a functional medicine plan. What I just said about the immune system and the important role that the white blood cells play in actually knocking down the parasite ourselves rather than relying on an antiparasitic, it's really important. So in addition to the herb or to the prescription drug, functional medicine plan to go after parasites, it's also going to support the production and the function of white blood cells. So in particular, we may look very closely at nutrition and make sure that the vitamins and minerals that are in the diet are ones that are going to really help us with white blood cell production and activity. So we want to support the body with food as medicine in this way. Most of us who are listening to this video are familiar with functional medicine. Of course, it is a holistic approach to health with principles that encourage us to try our best to identify and treat the underlying causes of disease rather than managing the symptoms alone. And through the lens of functional medicine, the body's systems are absolutely interconnected. So when one thing becomes imbalanced, it's so easy for another part of the body to become imbalanced, and this affects the health of the whole being. So this holistic approach to health is why functional medicine treatment strategies targeting parasite infection can include way more than just killing the parasite. So in addition, we're using food as medicine with nutrition. We're also providing immune support. We're fortifying the microbiome and working to try to reduce inflammation in the body. So treatment plans that satisfy these goals certainly allow for a more effective parasite cleanse, certainly allow the body to achieve more balance again and support optimal health. So let's talk a little bit about parasite cleanse protocols. There's a lot of different ways to approach a parasitic infection. For sure, in conventional medicine, and sometimes even in my office, a anti-parasitic medication is the treatment of choice. And for some patients, this absolutely is necessary. However, a lot of my patients prefer alternative parasite cleanse methods, including those in the functional medicine toolbox. So before starting any treatment protocol, if we suspect a parasite, appropriate testing absolutely should be performed, and we need to identify what the parasitic species is. And like I said earlier, this is best done through appropriate testing and through a provider who really knows all the ins and outs of physical exam, testing, and treatment for parasitic infections. Parasite cleansing protocols, such as those employed in my office, have 4 important components. So we talked about it before: an antimicrobial agent, an antiparasitic, immune support, detoxification support, and nutrition support. Many herbs have been well studied for their antiparasitic properties. These are antimicrobial plant properties that disrupt the parasite's life cycle by either inhibiting growth or inhibiting its ability to replicate. So let's talk about some of the herbs that have been best studied that we use most often for parasite infections here at my office. Wormwood, absolutely, also known as Artemisia, well known for its antiparasitic properties. It's effective for treating many helminths and many protozoa. It's rich in a compound called thujone, which performed as well as antiparasitic medication in animal studies. And also in a clinical study, 500 milligrams of wormwood 3 times a day successfully eradicated Entamoeba histolytica in over 70% of the patients. So wormwood's been used in a lot of different parasitic infections. It actually is a really great go-to and one of the first ones I reach for. It's also commonly in some formulations with multiple herbs that are designed to use in treating parasites. Black walnut is another herb you may be familiar with. It's rich in tannins and a compound called juglone. And black walnut is absolutely a robust antimicrobial, definitely highly toxic to parasites, also effective as a natural herbicide and insecticide. Oregano oil is another common one that you'll see in herbal formulations for parasite. It is rich in something called carmicrol and thymol, both substances proven to be strong antiparasitics. They work by inhibiting the growth and the reproduction of parasites. Clove is another one we use often. Clove is rich in eugenol, which is a strong antiparasitic. It actually breaks up the cell membrane, so it does damage to the cell membrane integrity of the parasites. And then lastly, garlic. Don't underestimate the power of garlic. Garlic is great to use in the diet when you're treating parasites, but also we can extract the allicin, which is one of the medicinal components of garlic that has been shown to be very effective in treating various helminths because it inhibits their growth significantly. So those are the herbs that are most commonly employed. Several simple lifestyle strategies can be employed to limit the risk of parasitic infection. And this is where, as a provider, it's important that we remember the power of taking a few moments and sitting down and educating our patients. So something as simple as recommending frequent hand washing, especially before meals, recommending frequent showering with hot water and soap, recommending that they wash their clothing regularly. All of that alone can make a big difference in their risk for parasitic disease. In addition, ensuring proper preparation of their foods, making sure animal protein is cooked to the recommended internal temperatures, making sure their water is clean and safe. Also, making sure that they check their pet regularly for insects and follow their veterinarian's anti-parasitic protocols is also very important. In addition, the functional medicine recommendations to limit parasitic infection also include incorporating some foods that have been well studied for their anti-parasitic properties. Those include raw garlic and raw honey. In addition, there's some evidence now that adding a zinc and a vitamin C, our probiotics and our digestive enzymes also can reduce the risk of parasitic disease. As I mentioned previously, diagnosing parasitic infection can be challenging due to the wide variety of symptoms that can be present, including symptoms that overlap with a variety of chronic health concerns. This alone can lead to the diagnosis being easily overlooked for many years. Another challenge when addressing parasitic infections is the growing resistance to drug and herbal treatments. So parasites are gaining one up on us when it comes to parasite treatment. So slowing down, taking the time to order the correct test in an effort to best identify the parasite, taking the time to research and make sure you're aware of what antiparasitic is going to be most effective against the parasite that has been identified, and making sure you're prescribing the antiparasitic for the duration that is necessary in order for success is also important. Last special consideration when treating parasites or looking for parasitic infection is paying special attention to those who are at highest risk, which is our immunocompromised patients, our pregnant women, our children, and our infants. These groups are certainly at higher risk of infection and at higher risk of more severe disease. So thanks for joining me today. I hope that you learned all you ever wanted to know about this complex but very important subject of parasites.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.